One of the really popular questions that we get here at Woven is, what exactly is EMDR? EMDR stands for eye movement reprocessing and desensitization, and it's essentially a type of therapy that helps you process through your trauma. And we do that using eye movement. So some practices will use like a light bar that signals for you to move your eyes back and forth. Sometimes we'll use a wand and we'll ask you to follow it. Sometimes we'll have you tap across your shoulders and across your chest. Sometimes we'll have you tap on your legs. So those are the different kinds of dual attention and reprocessing stimuli, which is just essentially us inviting you to think about a really painful event. And that's probably the worst part of EMDR, is that we call up a memory and then essentially we mimic REM sleep. So you know how when you go to sleep and your eyes are moving back and forth really rapidly and you can kind of see it under people's eyelids. So that in some ways, what we believe to be true in the science community is that that is somehow taking all of the events that have happened in your day, your week, your month, and it is processing through those. So it's moving it through your limbic system, so where you feel your emotions are really heightened, and when it's an older part of your brain that really responds quickly, and it's moving it through different processes, different brain structures into your long-term memory and through your prefrontal cortex, which helps you make sense of those experiences. Our best guess is that that is what eye movement is doing, that rapid eye movement is doing while you are asleep. And EMDR, as best as we can understand it, is attempting to do the same. So we have you call up a memory, we have you think about the feelings and the bodily sensations that come up. You're in a safe and contained environment with a trauma specialist, and then we have you move your eyes back and forth. It's a rather simple process, but because we're calling up trauma and really upsetting material, you definitely want to do this with someone that's trained, knows what they're doing, and has a really solid understanding of trauma responses, and trauma treatment. Turns out that's exactly what we do at Woven. I'm Dr. Quincee Gideon. I'm the owner and lead psychologist at Woven, and I specialize in trauma, and I have built a team of people that specialize in the treatment of different trauma disorders. What we have found with EMDR is that it's a really specific way that we can help someone address those deeply triggered states that so many trauma survivors are in. It's an attempt to really help them manage those very heightened automatic triggered states that you get into that prevent you from being able to make sense of your trauma narrative, make sense of your responses that you might have in your everyday life, in your job, in your relationships while driving in the car. I mean, the way that we show up in the world is very dictated by our experiences. And if you're walking around feeling triggered all of the time, like different experiences are constantly snagging your sweater and kind of holding you back and tripping you up, then EMDR might be a really good option for you. It's a good place to start. And then at Woven, we are really adamant about making this a relational approach. So most of our folks that come in to start EMDR therapy end up staying with us to work on more of their long-term stuff, the ways that trauma has impacted their life, their body image, their relationships, their feelings of safety in the world. So we really address the traumas in one way, and then when we get someone feeling safe, we help them move into a different season of their treatment. That's what makes us a little bit different at Woven. We're trying to help you combine that desensitization work that's really important and we can do through EMDR, and we're trying to combine that with a really warm, supportive, thoughtful, and informed relational space with your trauma therapist. We would love to have you join us. We would love for you to take advantage of this. If you have any questions, if you feel confused about anything that EMDR might do, might bring up, might be like in the therapy room, we are always here to answer those questions. Reach out, schedule a free consultation with our EMDR specialist, and we'll get back to you. We'll talk you through all of the nitty-gritty. We would happily support you in that process. We look forward to supporting you in your journey.